Good evening, students. In this session, we will continue the respiratory disorders. Under these respiratory disorders, the very first one is the asthma. So, what is the asthma? Under this asthma, here commonly respiratory passage is swelling. Whenever the respiratory passage is swelling, what happened? Gaseous exchange is not effectively done. It leads to a disease called as the asthma. What are the causes of asthma means? Some of the allergens makes the swelling of respiratory passage. Certain allergens makes the swelling in respiratory passage. So what are the allergens? Common example are the dust particles, pollen grains, chemicals present in food and water. Whatever the food we are eating and water we are drinking, in that any chemicals are there. Those are also cause for the, what is that? Asthma. And also, what is that? Animal dander. Animal dander and hair. These are the some of, and hair also. Animal dander and hair also responsible for the asthma. Then certain non-steroidal anti-inflammatory drugs are also responsible for the, what is that? Asthma. Non-steroidal anti-inflammatory drugs. Some of the medicines used for the prevention of the inflammation, those are also cause for the asthma. That is only we are simply called drug allergy. If the dust getting by a, if a dust is the cause for the asthma means that is only we are common word using the dust allergy. Like that a different kind of allergies. For example, a person can be consume the food, then cause the asthma, that is the food allergy. Like that a common words also we are using for the asthma. Now, what are the symptoms we are observed in the asthma patient? Symptoms are coughing, wheezing, then next one, short breath. Short breath means unable to take the breath properly. Then weight loss, anxiety. These are all the symptoms we are observed in the asthma person. Then after that asthma, we go for the some other disease like that of emphysema. What is the emphysema? Emphysema is a disease caused by the cigarette smoking. Here, due to the cigarette smoking, alveolar sac is damaged. Alveolar sac is damaged by the smoking. It is a major cause of emphysema. Whenever the alveolar sac is damaged, then what happened? Gases exchange is not done. So here also gaseous exchange is not done. Whenever the alveolar sac is damaged due to the smoking, gaseous exchange is not done. The next one, what are the symptoms we are observed under the in emphysema? Gaseous exchange is not done. What are the symptoms we are observed under the emphysema? So what are the symptoms? Here also the same problem. What are that? Wheezing, short breathness, and also the short breathness, anxiety, these are the symptoms we are observed under the emphysema. The next one, after that emphysema, we move to the pneumonia. What is pneumonia? Pneumonia is caused by Streptococcus pneumoniae. It is a bacteria caused by Streptococcus pneumoniae. It is a bacteria. It is a causative organism of pneumonia disease. Then, whenever that disease is there, what are the problems we are observed in the patient? Here, mucus production is more produced and filled in the air sacs of, the alveolus of lungs. Alveolus of lungs. Whenever that lungs are filled by the mucus, the person is unable to perform the breathing. All are respiratory disorders. That's why breathing is the major symptom in these respiratory diseases. Short breathness is the major symptoms we are observed. The symptoms were observed under the pneumonia is, first one is the breathlessness, sputum production, these are the common symptoms, and also some other symptoms like, what are the other symptoms are? Headache, dizziness. These are the other symptoms we are observed under the pneumonia. The next one, after that pneumonia, chronic bronchitis. What is the meaning of this? Swelling of bronchi. Whenever the bronchi is swelling or inflammation is done in the bronchi, then what happened? As usually, breathing trouble is arised. Swelling in bronchi. That is only called chronic bronchitis. It leads to what? Breathing difficulty. Breathing difficulty. Symptoms are as usual. What are that symptoms are? Breathlessness, nothing but of the short breath. Short breath is the common symptom. So, a very important symptom is the short breath and also the coughing. All those symptoms were observed. Then after that bronchitis, we move to the SARS. What is SARS? Severe acute respiratory syndrome is called as the SARS. It is caused by coronavirus. What is the causative organism of this SARS disease? Coronavirus. What are the symptoms we are observed in the person? Symptoms are chills and also the fever, headache, vomiting. All these are the symptoms we are observed in the SARS disease. This is also one of the respiratory disorder. Then after the SARS, what is the COPD? Chronic obstructive pulmonary diseases. Chronic obstructive pulmonary diseases are called as the COPD. Chronic obstructive pulmonary diseases. What are the diseases coming under the chronic obstructive pulmonary diseases? Asthma, then emphysema, chronic bronchitis. These are the diseases coming under the COPD. Remaining other diseases, respiratory diseases, which are not much danger to the human beings. But these three diseases, asthma, emphysema and chronic bronchitis, are fatal to the human beings. That's why which are coming under the COPD. COPD means chronic obstructive pulmonary diseases, which will make the damage maximally to the lungs. The next one. After that, what is the meaning of asphyxia? Asphyxia means carbon dioxide levels are more in the tissues. Carbon dioxide levels are more in tissues. It leads to the breathing difficulty. That is only called asphyxia. What is the hypoxia? Oxygen levels are less in tissues. That is only called as hypoxia. Then it is also leads to the suffocation. Then epistaxis. Epitaxis. What is the epitaxis? Nasal or nose bleeding. Whenever the bleeding we are observed in the nose, that is called as the epitaxis. Epitaxis is the called as what? Nose bleeding or nasal bleeding. Then what is a asphyxia? Means carbon dioxide levels are more in the tissues, leads to the respiratory disorder. And hypoxia means less the oxygen in the tissues. Epitaxis means nasal bleeding. Then after that, what is the acornia? I mean the acornia. It is nothing but of carbon dioxide levels are less in the tissues. It is only called as the acornia. Then what is the meaning of mesothelioma? Mesothelioma. Mesothelioma means whenever a person is exposed by the asbestos dust, the person is suffered by a cancer that is called as the mesothelioma. A person exposed by asbestos dust. A person exposed by asbestos dust leads to cancer. It is only called as mesothelioma. Then silicosis. What is the silicosis? A person exposed by dust. Inhalation of dust by a person. Inhalation of a dust by a person, it leads to a disease called as silicosis. That means lungs are highly damaged in this silicosis disease. So breathing difficulties commonly were observed. Then after that, one more disease is the asbestosis. What is this asbestosis? A person is exposed by asbestos. A person is exposed by asbestos. So that what happened? The lungs are become fibrosis. The next one, what happened? Because of the exposure of asbestos dust, what happened? Lungs become hard. This is only we are called as fibrosis. Whenever the lungs are more hard, they can lose the elasticity. Then what happened? Exchange of gases will be not possible. So fibrosis is the nothing but of what? Lungs become more hard. Hardening of lungs or lungs become hard. It is only called fibrosis. Why? Because asbestos dust is exposed by the person. The next one, byssinosis. A person exposure by the, what is that? Cotton fiber. A person inhale the cotton fibers or exposure to the cotton fibers, then a disease is called as the, when a person is suffered by a disease is called byssinosis. It is also called brown lung disease. It is also called what? Brown lung disease. Thank you very much, students. Next session we will continue.